It's always called me Miss B.
How old are you?
12. I have 15 personalities. My name is Paula. Cynthia, Joseph, Mariah, Michael, Rose, Jonathan, Secrets, Melinda, Teddy Claire, Freedom, Mama, Miss V, Radar, Mrs. R. I call myself the host. I'm like the CEO. I'm in charge.
Hello guys, hi everyone, I'm your boy Tanush Chandran. Today I'm going to explain you or going to talk about a disorder which is called Dissociative Identity Disorder. Previously it has been called as a multiple personality disorder. So today I'm going to explain about the disorder, about the symptoms, and about the treatments that a person could receive if the person have dissociative identity disorder. So hang on, sit back, relax and enjoy. In DID, dissociative identity disorder, we have three main elements, which is host, alter, and co-consciousness. What is a host? The host is the primary or the dominant identity that is usually in control of the individual's behavior and actions most of the time, okay? So the identity may be the one that interacts with the external world and functions in a day-to-day life. Like mostly day-to-day activities. The host may or may not be aware of the other identities, which we call alters, within the system. Finally, we have alters. Alters are the different or distinct personalities or identity states that exist within a person within the ID. Each alter has its own unique set of traits, behaviors, memories, and way of perceiving the world. Alters may serve specific functions such as managing emotional pain, handling traumatic memories, or responding to specific triggers. Alters can range widely in characteristics including age, gender, personality, and abilities. Lastly, we have co-consciousness. What is co-consciousness or co-alters? Co-consciousness refers to the situation in which two or more alters are aware of each other's presence or share memories and experience. Some individuals with DID have alters that communicate or are aware of each other's actions and thoughts, while others may have little to no awareness of the other personalities. Co-consciousness can lead to better integration and cooperation among alters, though this is not always the case. We are talking about the same person which can have or can be diagnosed with DID, which a person with multiple personality disorder. It's like in one single person he can have multiple personalities. Like I'm Tanush, now I'm talking as a student, suddenly I can change to another identity as a father, like a really total different person. We are talking about the same person who have the ID can have multiple personality without the person knowing that other identity exists in their stuff. That I said about the host, alters, and co-consciousness, which the host might have the idea of other identity or may not have the idea about other identities, but the alters are referred to the identity exist in a person. Let's talk about prevalence of the disorder. General prevalence, DID is relatively rare in the general public or general population, with estimates ranging from 1% to 1.5%. However, some studies suggest that the actual prevalence may be higher as the disorder can be misdiagnosed or overlooked. In clinical population, DID is more commonly diagnosed in individuals who seek mental health treatment for symptoms such as severe depression, trauma, or complex psychological distress. Studies have found that DID may be present in up to 10% of patients in psychiatric settings, particularly those with a history of severe trauma such as child abuse, child rape, or maybe kidnapping, like that. General gender differences. DID is more commonly diagnosed in women than in men, with estimates suggesting that approximately 70 to 90% of individuals with DID are female. This is believed to be due to the higher rates of childhood trauma, particularly sexual abuse among females, although this is still a topic of research. It's important to note that due to the nature of the disorder, which is have multiple identities or multiple personality in a person, people with DID often have long standing trauma histories and may not immediately seek help for dissociative symptoms, which can delay diagnosis and contribute to underreporting. So let's take a look on signs or symptoms of this disorder. Firstly, we have disruption of identity. There's a marked uncontinuity in the individual sense of self and agency, which may involve different behaviors, thoughts, emotion, and perception. Also, the distinct identities may take control of the individual's behavior at different times. Secondly, we have recurrent gaps in memory. Individuals with DID experience recurrent gaps in the recall of everyday events, personal trauma, and personal information. These gaps are beyond ordinary forgetfulness and include inability to remember everyday activities, loss of memory about personal history or identity, inability to recall events during periods when another identity was in control. Thirdly, we have distress or impairment. The symptoms of DID cause significant distress or impatience in an individual, social life, social, occupational, or other important areas of functioning. According to DSM-5, DID often arises from severe trauma, particularly chronic childhood abuse or neglect, and involves that splitting of identity as a coping mechanism for dealing with overwhelming psychological stress. These criteria help differentiate DID from other mental health disorder or mental health conditions that might involve dissociative symptoms, such as depersonalization, derealization disorder, or post-traumatic stress disorder. So we also have genetic and biological factors. DID is primarily caused by severe prolonged childhood trauma, particularly physical abuse, sexual abuse, or emotional abuse, often in the context of unpredictable or unsafe environments. Dissociation becomes a coping mechanism when the person is unable to process overwhelming experiences in a typical way. We talked about the causes. What the risk of this disorder? The risks associated with dissociative identity disorder, DID, primarily involve the long-term psychological, emotional, and social consequences that arise from both the disorder itself and the trauma that often contribute to its development. Individuals with DID are at risk of various challenges in their life, in their mental health, functioning, and relationships. One of the difficulty or risk is difficulty with daily functioning, memory gaps, interpersonal problems. For example, for memory gap, it is people with DID often experience significant gaps in memories, which can interfere with their ability to manage their daily activities. Emotional and psychological distress, depression, anxiety, PTSD, self-harm, or suicidal thoughts. So let's talk about the intervention for this disorder, for this particular disorder. The intervention for dissociative identity disorder primarily involves psychotherapy, treatment that aims to integrate the separate identities, address underlying trauma, and help the person develop healthier coping mechanisms such as psychotherapy, trauma-focused therapies like cognitive behavior therapy (CBT) or trauma-focused cognitive behavioral therapy (TF-CBT) or dialectical behavioral therapy (DBT), eye movement desensitization and reprocessing (EMDR), integration of identities. So these are the most used therapy to treat a person who diagnosed with DID. So my message to the public, to the outer world, to spread awareness on this disorder is DID is a real and complex disorder. DID is a legitimate mental health condition, not a sign of weakness or fantasy. It is coping mechanism developed in response to severe trauma, often from childhood abuse. Understanding DID is the first step towards supporting those who live with it. Secondly, it's about trauma, not personality. DID is not having multiple personalities for entertainment or drama. It is response to overthinking or overwhelming trauma. People with DID experience dissociation as a way to survive emotional pain and protect themselves from unstable memories and environment. Healing take times. So DID usually takes time to heal, to recover. So you have to be supportive. That's all from me about DID. I think I covered all of the important keys to this disorder. So I guess that is all for today, and stay safe and seek help if you really need help. Thank you and see you the next time. Bye.